What is Bell's palsy? Bell's palsy is a type of facial paralysis that results in a temporary inability to control the facial muscles on the affected side of the face. In most cases, the weakness is temporary and significantly improves over weeks. Symptoms can vary from mild to severe. They may include muscle twitching, weakness, or total loss of the ability to move one or, in rare cases, both sides of the face. Other symptoms include drooping of the eyebrow, a change in taste, and pain around the ear. Typically, symptoms come on over 48 hours. Bell's palsy can trigger an increased sensitivity to sound known as hyperacusis. The cause of Bell's palsy is unknown, and it can occur at any age. Risk factors include diabetes, a recent upper respiratory tract infection, and pregnancy. It results from a dysfunction of cranial nerve 7, the facial nerve. Many believe that this is due to herpes simplex virus infection that results in swelling. A 68-year-old woman comes to the emergency department for evaluation of stroke-like symptoms. The patient says her face appeared twisted this morning but was normal when she went to bed last night. Her brother recently had a stroke, and she was worried that she may also be having a stroke. The patient has a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus. Vital signs are within normal limits. Physical examination shows facial asymmetry with drooping of the left corner of the mouth and loss of the left nasolabial fold. Which of the following additional examination findings on the affected side would be most suggestive of central nervous system involvement? The correct answer is E, sparing of the forehead muscles. Voluntary facial movement is initiated by the motor cortex, located in the frontal lobe, which delivers input to the facial nerve, cranial nerve 7, a peripheral nerve that innervates the muscles of facial expression. Central or peripheral lesions can often be distinguished by assessing movement in the upper face. Central nervous system lesions, for example stroke, typically affect the motor cortex or the descending tracts. This results in contralateral lower face weakness. However, the nuclei that innervate the upper face receive bilateral input from the motor cortices. So movement of the upper facial muscles, for example forehead, brow, is often spared. Peripheral nerve lesions, for example, Bell's palsy, affect the entire facial nerve. This results in unilateral weakness of half of the face. Forehead movement is lost. The most common cause of acute unilateral upper and lower facial weakness is Bell's palsy, an acute peripheral neuropathy of cranial nerve 7. Common findings include an inability to raise the eyebrow or close the eye, drooping of the mouth corner, with the mouth drawn to the unaffected side, and disappearance of the nasolabial fold. For most patients, partial or complete recovery occurs within 3 to 4 months. Choices A, C, and D. Patients with facial nerve lesions often have decreased tear production due to loss of parasympathetic innervation to the lacrimal gland, hyperacusis due to weakness of the stapes muscle, and decreased sensation of taste over the ipsilateral anterior 2/3 of the tongue, which is innervated by the chorda tympani nerve, a branch of the facial nerve. Choice B. The platysma muscle, responsible for tensing the skin on the neck, is also innervated by the facial nerve. It would be affected in both central and peripheral lesions. Educational objective. Because the upper face receives bilateral input from the motor cortices, central nervous system lesions typically cause lower facial weakness that spares the forehead on one side of the face. In contrast, peripheral lesions, for example Bell's palsy, cause weakness of the entire side of the face. Bell's palsy may also result in decreased tear production, hyperacusis, and reduced taste sensation.